It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. This is Stacy Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And I have got a great guest for you today for you to listen to. This is Dr. Hotze's chiropractor. So even Dr. Hotze has a chiropractor that he uses from time to time. So I know you will benefit from hearing natural approaches to health through chiropractic care. Dr. Hotze.
Thank you, Stacy, and thank each one of you for joining us today on Dr. Hotze's Wellness Revolution, where I believe that you and every individual needs a doctor and a staff of professionals who can coach them on a path of health and wellness naturally without using pharmaceutical drugs. So as you mature, you've got energy, vitality, and enthusiasm for life. Today, I'm so glad to have my friend and chiropractor, Dr. Bill Sheppard, who's the director of the United Chiropractic and Medical Center here in Katy, Texas on Mason Road. Dr. Sheppard, good to have you with us, my friend.
Dr. Hotze, it's a pleasure as always. Thank you so much for inviting me.
You're not going to hear many physicians interviewing and promoting chiropractic care because they're not trained in that, and they look at it as many doctors look askance at it because they don't even know what chiropractic medicine does. Dr. Sheppard has helped me in many a situation where I've thrown my back out, literally getting out of a car. All of a sudden, I twisted my back and I could hardly walk. And I went over and he adjusted me and fixed me up. So I've had several occasions over the last 10 or 15 years. I've called up and said, Dr. Sheppard, can you work me in? And he did, and he helped me out tremendously. But chiropractic care provides primarily care for people with back pain. You were telling me what percent of the population has back pain?
80% of people sometime in their life have a bulging disc, but more money is spent on back pain than anything in health. More than cancer, more than heart disease. More money spent on back pain.
And so if you go to a conventional doctor, here's what they do. They either give you a drug, a muscle relaxant, or a pain reliever, or if things are bad enough and you see the wrong doctor, a surgeon, he's liable to pull a knife out and operate on your back. So they have drugs and they have surgery to offer you, which none of which corrects the underlying problem. Surely the medication doesn't. It simply masks the symptoms. Before we get into your treatment of back pain, you've got an interesting story. Tell us how you got interested in chiropractic medicine. And by the way, Doctor graduated from the Texas Chiropractic College of Medicine, and you went in when you were older. You didn't go into chiropractic right out of college, did you?
That's correct. I was groomed my entire life to go to medical school. I love science and I love people. So I was like, well, let's become a doctor. So even in high school, I was taking courses to prepare myself for my undergraduate studies. So I did get a degree in human biology for my undergrad with my intent on going to a medical school. Well, I got into a horrific motor vehicle accident. I broke 29 bones. I've had 26 surgeries. They called Life Flight for me, and pretty close three different times to dying. And it was a heart-wrenching time for my family, myself, my friends. I almost didn't make it. So my life was saved by medical doctors, as I said, and I took a lot of medicine, which I needed at that time. But there had to be something more past that because I got to a point where my pain was stagnant. Nobody could help me, and they were prescribing, medicine, hydrocodone, meloxicam, Flexeril, and it just wasn't doing the trick. There had to be something more. So I ended up going to a chiropractor, never even heard of one, and I went to a chiropractor, and the guy changed my life. And so, long story short, here I am.
So that's what got you interested in chiropractic medicine, right?
Absolutely.
So tell us, what are the common problems that you see in your chiropractic practice, the kind of pain or the back pain that people have? Describe what you see and what causes these problems.
Well, we see predominantly back pain, and we see quite a bit of neck pain as well, headaches, and even shoulders and knees. But with the back pain, patients coming in, and something I didn't learn in school, Dr. Hotze, but I learned from my patients, because sometimes we'll take an x-ray, sometimes we'll even do an MRI to investigate further, and people have a bulging disc. And I ask all the patients, what did you do? How did you get these bulging discs? This is what I've heard in 20 and a half years. I hurt my back picking up shoes, socks, keys, cell phone, dinner plate, laundry, kids, car seats, mulch in the yard, girls bending over to blow dry their hair, bending over to armor all their tire. Bending at the waist seems to be the culprit. It's very rare I get somebody that lifts something heavy that hurts their back. Mm-hmm. It's usually very simplistic type things, and I've fallen in that same category myself.
Well, so tell me, when people come in, how do you decide whether they need an adjustment of the spine or of the neck, or whether they need something like spinal decompression?
We do a thorough exam. We do the history, the examination, and we can determine pretty well from there what's going on. We do have a digital x-ray machine, so we take x-rays and right away we look at those and we show the patient and we describe what's going on. I'd like my patients to know when they leave exactly what's going on, because my experience with some of the physicians, I would walk out of the office and my wife would ask me, what'd they say? And I'm like, I don't know. So I explain it to my patients, and I use the analogy of their disc being a jelly donut. And they're pretty crystal clear on what's going on. But if they do have a bulging disc, if we go further and do an MRI diagnostic imaging, we'll do the spinal decompression on them. And we explain that very well to the patient. And the machine has an 86% success rate, which is higher than chiropractic, physical therapy, medicine, injections, or surgery. It's actually rated the #1 way to fix a disc in your back.
Okay, tell us about spinal decompression. What does that involve?
The machine, I kind of joke with my patients, it looks like an ATM with a bed hooked up to it. You get all strapped up like you're going bungee jumping, and you'll stand up on the machine, and then we push a button, the machine will lay you down, and very gently the machine will kind of pull your spine north and south, very gently. It's all programmed in there, and the patients, a lot of them fall asleep during their treatment. It lasts about 30 minutes long. But if you can imagine the disc as a jelly donut, when you have a bulging or herniated disc, that jelly is coming out, just like a jelly donut. The machine, as I explained to my patients, is kind of like grabbing the disc by the top and bottom, pulling north and south, and it creates a negative pressure. You force oxygen, fluids, and nutrients in the disc. More importantly, it stimulates your fibroblasts, which is the name of the cells that make up your disc. When you stimulate them, you get new growth, and it actually helps to repair the area.
Well, so how many treatments do you have to solve a disc problem?
Well, the worldwide protocol, whether you're doing it here in Katy, Texas, or you're doing it in Australia or China, you do daily for 2 weeks, and then you do 3 times a week for about 3 more weeks. So it's 20 sessions worldwide. Most patients start to feel some pain relief within about 6 or 7 treatments. So we know the machine's working.
So these are people that if they went to maybe an orthopedic surgeon, might be a candidate for surgery.
Almost all of them are, because some people come see me as a last resort. Right. So they've been to the medical doctor, they went to their GP, then the GP, general practice doctor, referred them to an orthopedic surgeon. They've been recommended for surgery, and patients want to find an alternative. Over the years, I've had 19 spinal orthopedic surgeons actually send to me patients. I have doctors and surgeons that come in to use the machine. So that's pretty flattering when they come to see me.
You bet. That's tremendous. So, and what kind of success rate do you have with these, with non-surgical spinal decompression?
We have a huge success rate. And statistically, with the machine, 86% success rate. So not too shabby there.
Well, I want you to listen to that, because my experience in medicine has been is I've seen people with back pain that have had back surgery. I've always said that's your last absolute resort is back surgery, because once you start cutting on your back, I just see it happen. Then you get another surgery on your back and another one.
Very true.
And then you may not be a candidate for doing some non-surgical spinal decompression. They put plates in your back and all kinds of things.
Absolutely.
So if you've got a compressed disc, a bulging disc, and you're having severe back pain, this usually occurs in the lower back, doesn't it?
It does. Low back, usually L4, L5, or maybe L5.
That's your lumbar vertebrae. You have 5 lumbar vertebrae, and that's down in your lower back, just above the hips, and that's where most people get their back pain. That's very common. I don't know what percent of people have lumbar back pain that have back pain. I'm talking about the whole spinal cord. What would you say?
Well, 80% of the population, sometime in their life, have a bulging disc.
Yeah.
And
what percent of that would be in the lumbar spine?
Oh, the mass majority.
Yeah.
The mass majority. We do cervical spinal decompression as well,
Right.
which is very popular. But because of the incidence of the back pain, we see a lot more back pain patients.
Sure. So this is a great opportunity for you to avert surgery by getting non-surgical spinal decompression at Dr. Sheppard's office out here on Mason Road. Just briefly tell us something about spinal manipulation or adjustments that you do when you take and call them crack the back. I mean,
Sure.
Tell us about that.
What
is happening? Why does that sometimes relieve the pain? Because I came in one time, I got out of my car and I had lower back pain. I was walking around, I could hardly walk, and I remember you adjusted that back and it went pop, and the pain went away.
Well, they'll pop you here just like a lot of people, pop their knuckles, or they, pop their neck or
Right.
back on their own. And what that is, whenever you have 2 bones in a fluid environment, just like your knuckles, and you pull it apart, it forms an air bubble and it pops. That's what the noise is. So when we do safe, spinal manipulation, whether it's the neck or back, there's some apprehensive patients, and we cater to chickens.
Sure.
But I explain what we're going to do. We do the adjustment, which doesn't take very long at all. And they get off the table and they're like, "That's it." I'm like, "That's it." They're like, "I feel lighter. I feel better. I can move my neck. I can bend over." I'm like, "That's great."
It's really remarkable. Tell you a quick story how I got interested in chiropractic. I lived in Austin. My wife and I lived in Austin back in the late 70s, and I was doing emergency medicine in Austin. And one day I walked into the kitchen and I gave her a big hug and told her I loved her. I picked her up and I heard her back go crack.
Uh-oh.
I heard it go crack, and she was in terrible pain in her upper thoracic spine, and it went on, and we gave her muscle relaxants and pain relievers. She went and saw doctors, and it went on for a year. And there was a friend of ours at the church we attended who was a chiropractor, and I said, go see Tom, Janie, and just see if he can help. So she goes in there, and she said when he manipulated me, there was like an explosion. She could hear it went, and she said the pain went away completely.
That's amazing. We see it every day.
I mean, it just went totally away. And then we moved back to Houston. About 3 years later, she had some pain. We had moved, I guess, box or something. It came back in the same spot. She went in and got it adjusted, and she was fine. So I have a great deal of respect for those that practice chiropractic medicine, and particularly for Dr. Bill Sheppard. I highly recommend, if you need care of your back, you have Dr. Bill Sheppard take a look at you and see if he can get you fixed up so you don't need to be on all these drugs. These doctors put you on drugs that are opioids, and you get hooked on those things, and that's not a good place to be. You don't want that to happen. And they were giving them out like candy here up until recently.
We had and still do have a huge opioid epidemic going on in the United States right now.
And, the drug companies knew what they're doing. They knew they were going to make it addicted to that, and they let these doctors pass this out like candy, and it's unfortunate. You don't want to get caught in that. Get your back fixed naturally by having a chiropractic examination by Dr. Bill Sheppard, who is the founder and the director of the United Chiropractic Medical Clinic on Mason Road out in the Katy area. It's on the South Mason Road. How can they see your website if they want to take a look? Where do they go to?
Our website is katyspinerehab.com, and they can certainly call our office at 281-392-6550.
Well, that's great, and I want to encourage you to do that. If you're having back problems, get in touch with Dr. Sheppard. Dr. Sheppard, thank you again for being here with us.
My pleasure, Dr. Hotze.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.